chronic renal failure. Chronic renal failure is typically the end result of a slow and progressive loss of renal function. It is primarily caused by the gradual destruction of nephrons, which are the functional units of the kidneys responsible for filtering blood and regulating various bodily functions. As more nephrons are lost, the kidneys gradually lose their ability to perform their normal functions. Without proper treatment, harmful uremic toxins can accumulate in the body and lead to potentially fatal changes in major organ systems. Now, let's discuss the various causes or etiologies of chronic renal failure. 1. Chronic glomerular disease such as glomerulonephritis. 2. Chronic infections, for example, tuberculosis. 3. Vascular diseases including hypertension. 4. Obstructive processes like calculi or kidney stones. 5. Collagen diseases such as systemic lupus erythematosus. 6. Endocrine diseases like diabetic neuropathy. Signs and symptoms of chronic renal failure. Next, let's examine the characteristic signs and symptoms of chronic renal failure. 1. Dehydration. Patients may experience excessive loss of body fluids. Dehydration can occur early in renal failure when the kidneys cannot concentrate urine, resulting in the elimination of large amounts of water. 2. Edema. This refers to the accumulation of fluid in the body's tissue spaces. Edema is more likely to occur in the later stages of chronic renal diseases when the kidneys cannot eliminate excess water properly. 3. Hypertension. High arterial blood pressure may develop due to fluid overload and increased production of the hormone renin. 4. Anemia. Patients may have lower than normal concentrations of hemoglobin in the blood for their age and sex. This condition occurs when the kidneys cannot produce the hormone needed to activate the production of red bone marrow cells. 5. Uremia. In severe cases, when nitrogen waste products in the blood reach high levels, urea can be converted into ammonia in the stomach and intestine, leading to ulcerations and bleeding. Treatment of chronic renal failure. There are 3 main elements in the goal of medical management for patients with this condition. 1. Maintaining normal body fluid volume and electrolyte balance. 2. Reducing tissue breakdown within the patient's body. 3. Preventing infections until healing occurs. To achieve these goals, a variety of measures are employed. 1. Restricting the patient's fluid intake to approximately 400 ml per day for the average adult. 2. Adjusting the patient's diet to limit sources of nitrogen, potassium, phosphate, and sulfate. 3. Vigorously treating infections with appropriate antibiotics, or treating anemia with a transfusion of a small volume of packed, fresh red blood cells to improve hemoglobin levels. Chronic renal failure is a serious medical condition that can have profound effects on the body's normal functions. Early diagnosis and appropriate management are crucial for improving patient outcomes and preventing the potentially fatal consequences of this condition.